And Tracy, we are learning that's not the end of the choices that will need to be made. There just simply will not be enough vaccine to go around, even to certain categories of workers at the very beginning. But with meetings like that one today, we are getting closer to shrinking the number of people that this virus can infect. As vaccines reach the final stages before approval, hope for help on the way.
I'm hopeful that they will both be approved by the FDA. And if they are, it's likely that we'll start vaccinating in mid-December.
In Philadelphia, the city's health commissioner says healthcare workers who are routinely exposed to COVID-19 will be the first to get access, but there will still be decisions.
I can tell you the hospitals will get vaccine that is less than the total number of healthcare workers they have, and so they're going to have to make the decision about who are the highest risk among them.
In these final steps before the vaccine is distributed, medical experts from around the country are weighing in.
The FDA talks about whether or not a product is safe and effective. CDC's advisory committee, the Advisory Committee on Immunization Practices, which is meeting today, is talking about who will get the vaccine.
Dr. Angela Shen is a visiting scientist from the Vaccine Education Center at Children's Hospital of Philadelphia. She tells us meetings of the FDA's advisory board are scheduled for this month to address two different vaccines.
The FDA asks them specific questions. So they'll say, we're going to give you this data to take a look at. We'd like you to opine on this portion of it.
The committee might make suggestions, and the FDA takes that information and makes a decision about approving the vaccine in what's called an emergency use authorization. But as preparations are underway in Philadelphia and other cities to receive the first doses, it could take a while to get to you and your family.
In terms of being able to go like you do for your flu shot to your doctor's office or to your pharmacy, it'll be into 2021.
By then, there could be multiple vaccines available. Right now, health officials are waiting for the first ones to get a green light.
Will you get to decide, or will the city get to decide which vaccine you want, which one you think fits the population here?
We'll take whatever vaccines the federal government has approved and we think are safe.
Now, the head of the CDC panel that met today said they wanted to meet now so that local governments could start to place initial orders of the vaccine. But they will have to meet again to decide who gets the vaccine next, whether that is frontline workers like police and firefighters, teachers, or those with underlying medical conditions. Tracy?